So thank you so much to Thomas and Meryl for inviting me here today and setting everything up. I'm very excited to share my story with you, and hopefully my story can help kind of transition into your life and you can start to be an advocate for virtual reality in healthcare as well. So we'll get right into this. So, Voice for Virtual Reality, the advocate's role in spreading awareness for patient use. I know Thomas said that I advocate for oncology patients to use VR, which I absolutely do. And since introducing my grandfather to VR about 6 months ago, I have been given the opportunity to see how the older population, older healthcare population, can also use virtual reality. So that's kind of another avenue that I'm to go down and look into it. So first of all, thank you so much for your time and thank you for being here as a guest. And a little bit about myself. I am a registered nurse. I've been a nurse for about 16 years now. I've worked in obstetrics and primary care, orthopedics, and patient education. I really, really enjoy patient education. That's one of my passions no matter what I'm doing or what specialty I'm working. I love being able to give back to patients and putting the power in their hands to take control of their own. So, as Thomas previously mentioned, I am a cancer survivor. The first time I was diagnosed was in 2014, so I have been dealing with the world of being a cancer patient and cancer survivor 7 years now. I started using virtual reality in 2018, and about 2 years ago, I became a self-proclaimed VR advocate, specifically for using virtual reality in healthcare and for healthcare purposes. So quickly, I don't have any conflicts of interest to disclose today. No information that I'm sharing with you, I'm getting paid to share with you, and I don't get any kickbacks for anything that I. Some goals for the next few minutes and for this presentation. One, to identify how VR helps patients, to identify some of the barriers to using virtual reality that some patients experience, and to hopefully by the end of this presentation, you can identify one way to increase accessibility of virtual reality for patients. And patients can mean people in your family who are in the hospital or yourself using virtual reality in a clinic, even in a clinic waiting room. And hopefully you'll be able to share some of this information. My goal for you, my hope, is that you'll be able to share at least one thing with one person by the end of tonight, whether that's on social media or you can just tell somebody that you attended and just share one thing. That's my hope for you. So I'm going to start by sharing my personal story. So in 2014, like I said, I was diagnosed with cancer the first time. My diagnosis was Hodgkin's lymphoma, which is a blood cancer, and I had to go through 6 months of chemotherapy. And as a nurse, I thought I had a pretty good preparation for what I was about to go through. And I was pretty prepared for almost everything, but I was not prepared for the amount of pain that I experienced between the chemotherapy. I think when I went into treatment, I thought, okay, I know I'm going to lose my hair. That was obviously a big thing for me, especially for most women, I think, as our hair can sometimes help us identify ourselves. It sometimes is who we are. It's a part of us. It's a part of our personality. So obviously, that was a big loss. I knew that was coming. But I really did not know that I was going to be in such intense pain throughout this experience. And I would end up in the emergency room about a week after every infusion. And I was in intense pain. In healthcare, we ask, what's your pain level on a scale of 0 to 10, 0 being nothing and 10 being the worst you've ever felt. And I felt like I was in 10 out of 10 pain all the time when I was experiencing these episodes. So I would get morphine through the IV, but that would really only take the edge off for a short period of time. And I remember there were some times where I would be just laying in bed and I would fall, take the pain away. But as soon as I woke up, I was in pain. All right, so I had to deal with this pain that did not really have a purpose, because every test was done to make sure that there wasn't a problem. So pain usually tells us that there's something going on that we need to look for in our body. And all the tests were done, and there wasn't anything that was identifiable. So I was going through this cycle about every 2 weeks. I would go through this cycle where I would get chemo, I would be okay for a few days, and then a few days later I'd have this stabbing pain and I would end up in the ER getting morphine. And then I would go home, but I would still be in pain because I couldn't bring the morphine IV home with me. So I talked to my oncologist about this situation, and at the time I was going to an integrative oncology center called Block Center in Skokie, Illinois. And so it was already an integrative cancer center. They were doing things like massage and Reiki. So one of the things that they did for me for the pain was that they offered me a personalized pain meditation. It was about like a 10-minute meditation to help with the pain. It was an MP3 file that was emailed to me. That was back in 2014. So my first iPhone in 2014. So we didn't have things back then, right? Like the Calm app and whatnot. And sorry, my slides keep going backwards. Okay. So that meditation recording was $300, which is the same price as today's Oculus, right? Like your basic Oculus is $299. And think about all the apps that we can download on the device that we have now, the Oculus. So fast forward, it gets to 2015, I finished treatment and I'm in remission, thank goodness. I go back to work and I ended up going from orthopedics, and I went back and I got my certification to teach Lamaze. And while I was learning how to teach Lamaze class, we learned how to teach visualization and relaxation. These things are incorporated into Lamaze. So finding a focal point, breathing exercises, imagery. So I'm actually going to take you on a little exercise in a moment. I was teaching these 6-week classes on how to reduce pain for expectant parents. And with Lamaze, we're really trying to have the mother-to-be and her work on helping themselves manage their pain and manage the experience of childbirth and the discomforts that come with that. So it's a very empowering thing to teach labor and delivery expectant. And with Lamaze, there was so visualization. That was the one thing that really stuck with me, was the amount of visualization that we were teaching in these classes. So I'm going to actually go through one of the exercises that we teach in Lamaze. You're actually experiencing something that I used to do with teaching the class. For the next 30 seconds, I'm going to have you use your imagination, your real virtual reality that's already downloaded in your mind. And I want you to imagine that you are a patient. Doesn't matter what diagnosis, you go into the doctor's office and the nurse brings you in. Maybe the room is cold. That's the first thing that you notice, is that the air is kind of cold in the room. And you can close your eyes if you need to do this. If you need help visualizing this, just close your eyes, and I'm going to guide you through this. The nurse brings you into this cold room and she has you sit on the table that's in the room. And you sit on the table and you feel the cold paper underneath your thighs. And there's nothing else in the room. Checks your vital signs and she leaves, and she says, the doctor will be in a few minutes. So we're actually going to do a 30-second exercise. So for the next 30 seconds, you're going to wait in the doctor's office, in the clinic room, starting now. So you won't hear anything for the next 30 seconds. There's nothing wrong with your audio. You're just waiting in the doctor's office. And 30 seconds is up. So I'm not sure if any of you can react for me, but if you can click your react button and clap your hands if you felt that long 30 seconds. Okay, I'm hearing a lot of clapping. I'm seeing a lot of clapping too. Okay. So now we're going to do another mental exercise. The next 30 seconds starts now. Now I want you to imagine that you're on the beach. It's a beautiful day and there's not a cloud in the sky. The sky is a beautiful blue and the sun is shining down on your face. And you're absorbing the sunlight and you can feel the warmth on your skin. And you can hear and the waves are crashing at your feet. And that was longer than 30 seconds. That was about 35 seconds. I had you clap for the last one. If you could give me a heart emoji with your reaction, if you felt the second 30 seconds was shorter than the first 30 seconds. Really what we're trying to get with this exercise is that when your mind is occupied with something and those ideas are pleasurable ideas, those are nice ideas that you were thinking. And if you beach, it could be a rainforest that you. So I took this, what I learned from working in labor and delivery, and I took the experience that I had with this constant painful sensation while going through. And lo and behold, I saw a Google Cardboard for the first time in 2018. So I was still teaching Lamaze. I was in remission for cancer. And I tried the Google Cardboard for the first time. I one of the cardboard to watch news. There's one specific one that was in the rainforest, and it was all about the sounds of the rainforest. I remember how peaceful that felt. Even in the Google Cardboard, it wasn't very technologically advanced, and I was just using my phone and an app. But I thought, how can we combine what I'm seeing in virtual reality with what we teach in Lamaze and add on to that and give this to people who are experiencing painful sensations and uncomfortable medical situations in other situations outside of labor and delivery. So outside of just people who were taking Lamaze. So chronic pain, things like that. Things that I had experienced, like oncology pain. And so I started doing some research and I found Applied VR and like the time frame where everything just kind of exploded for me as far as virtual reality and healthcare. And all of a sudden I realized that my pain had given me a purpose, and I started researching different companies and finding out that VR for pain management really is a thing. And people have been doing research on this for years, even back from 1996, I found some studies. Now I want to talk about self-advocacy. So I discovered this thing and I thought, I wonder if this can work for me. Around the same time, ironically, I relapsed with cancer the second time. So that was around September 2019. And again, I thought, oh my gosh, okay, I know I have to do this treatment that's going to save my life, but I really don't want to do it because all I can remember was the extreme pain that I was in during treatment. And that was at the front of my mind the whole time leading up until treatment. I think looking back, it was probably a PTSD thing, because pain can be obviously something that sticks with you even when you're not feeling it in the moment. You remember that something is pain. Your body doesn't want to experience that. So what I decided to do, I decided that I would try the Oculus Go. So I brought the Oculus Go with me to the hospital when I had to go through a month-long stem cell transplant process. I knew I was going to be in pain and I was going to be in the hospital for about a month. So I was going to be bored and uncomfortable. So I brought the headset with me to Roswell Park, which was the cancer center that I was going to. And I had this plan to be very self-motivated and that I would just try everything. So there was really no set curriculum for me to do. It was just an opportunity for me to try and see if this worked for me. And again, I was self-motivated to try VR. So that really, I think for me, had a lot to do with its success because I wanted it to work and I was excited about it. So I used it for distraction and relaxation. When I did end up having pain again. It wasn't the same kind of pain, but when I did have pain the second time around during treatment, I would use the headset once the pain was semi-manageable and semi-under control. I would use the headset and I would go into apps or experiences that would really distract me from constantly thinking about the sensations that I was having, constantly experiencing the pain. So I could swim with the dolphins in VR, or I could go to the forest and watch the leaves fall slowly down. All of those things really got my mind focused on something else, focused on something outside of me. I also used Netflix in VR, and I have kind of a funny story to share about that. So in the Netflix app on the Oculus, it's pretty fun because you can be in a cabin in the mountains. And I remember being in that cabin in the mountains in my hospital room. And the cleaning lady came in and she started talking to me. And I'm not sure she saw that I had the headset on, or maybe she didn't know what I was doing. But she started talking to me, and automatically I went back into the hospital room. I was kind of frustrated because I wanted to stay in the cabin in the Netflix app, but that is just a testament to how immersed my brain was, that I really felt like I wasn't in the hospital anymore. Like, yeah, I knew I was still sitting in the hospital bed, but I could escape mentally if I wanted to, which was really cool because I couldn't even leave that unit. I wasn't allowed to go off the unit. I wasn't allowed to go outside. I had to stay on that unit, and most of my time was spent in that room. So virtual reality really did give me an escape that I needed, because to be in a situation that is stressful mentally, physically, and emotionally, the brain really appreciates some breaks once in a while from that constant everyday struggle. So let's talk. Now you know about my story. We'll talk about specifically advocacy. So when you start to advocate for something, you really have to see what works. So what worked for me was that the relaxation that VR gave to me helped me to decrease the stress that I was experiencing. And like I said, I could do things like swim with the dolphins or be in a forest where I enjoy nature. I engaged in VR in things that I like to do in real life. So I was able to get back that sense of self that I was losing from being a patient. So when you're a patient, you really, to me, I feel like I just become a number and a body in a gown. You really start to lose some of your own, some of your personality, because people are focused on healing your body, and VR kind of gives you a sense of self back a little. So I did things like I would go to the waterfalls, or I would do some breathing exercises. If I did a game, that was actually really helpful for the distraction from the pain, because I had to focus on the goal in that game. Whereas if I was at the beach, I could just relax. I remember one point where, so I was in the hospital in the middle of winter in Buffalo, New York, where number one, you don't see the sun very often, and it's usually gray outside. So I really appreciated being able to imagine that I was somewhere in summertime, and that was really healing for me because I really enjoy the beach. And this quick in this photo, this is me using the Applied VR headset. So I had the Oculus and Applied VR headset. This was my room and using the Applied VR headset at Roswell. So I shared this with my doctors. This is one of my transplant doctors here. I showed her swimming under the with the dolphins. Like, I knew that this was going to be my thing in the future. I knew that I was going to be all about it, and I wanted to share it with as many people as possible because I felt like if it was something that they have never seen before, that it would add some value somehow to see something, to see a new way of helping patients. So here she is trying out the VR headset, and she was really excited about it. That's the first time that she had ever used VR. And she actually made the comment that this would be great for palliative care patients. So I knew that already, like, she was starting, like, the gears were starting to turn in her head, and she was starting to think who she would advocate the use of VR for, which is great because kind of turned her into an advocate almost immediately because she was giving me examples of other types of patients too. So like I mentioned, first I wanted to talk about some of the barriers that someone might encounter when trying to use VR in healthcare. Number one, obviously, is awareness. The majority of healthcare providers don't use virtual reality every day, and many of them don't know that it exists. And if they do, they may have never been introduced to the idea of using it for their patients. And then the other question is where to start, like what apps should we use? One of my doctors saw me using the headset while I was waiting for her in the clinic room. She opened the door and she came in and she started asking me questions. She's like, this is great. This would be great for another patient that I have. How do I get this to my patients? And I was trying to like, okay, well, your patient could use an Oculus and then they could download this app. So where to start is a great question. Like, how do we easily get the right app and the right headset into other patients, right? So which headset, which program, where do we find the app? All the Oculus, or should we have a private entity? Is it another company? I don't want to use any specific names, but there are many VR companies that are specific for health. So choosing the right company for the right patient is important. And then how to download the apps or how to get the right programming into the hardware, and identifying opportunities for use. So which types of patients at what time? So if you have a pediatric patient over the age of 13, when should those patients use it? We can't necessarily have them using the headset when they're going through an MRI machine, but it might be great for when they are unhooked from their infusion and they have some time in between treatments, or maybe they are getting an IV. We also want to identify when we should not be using VR, right? Like I said, when certain tests are being performed, or let's say a patient isn't feeling well. If they're already having upset stomach, you don't want to burden them with something that they might not be able to focus on right now. The simplest way to advocate for VR in healthcare is to share it, just like I'm doing right now. And just like hopefully you'll be able to share some of this information with anybody and then test it out. So for example, I had somebody who saw this article that was about VR in healthcare that was featured in Cure magazine in the spring of 2020. So that's a photo of me from the Cure 2020. I think that link, Meryl posted the link 9 minutes ago in the chat. So I have this picture on the header of my social media. One of my friends, who's one of the support group buddies, my lymphoma support group buddies, saw this picture and he had to go for a stem plant. actually himself, and he contacted me and he said, I was looking at your profile after you had made a comment in the support group about something, and I was wondering about virtual reality. Maybe I could use that in the hospital. So I said, try this, try that. So you really just have to encourage people to try and test it out for themselves, and then let them decide what works for them. So in this situation, will Google Cardboard be enough? Will buying your own Oculus be what's right for you? Are you a physician, or do you work in a hospital and you'd rather have a contract with a company who could provide the hardware and the software, and you're going to pay for that for all of your patients in the facility? What you can, and then adopt what's appropriate. And then sharing the information is obviously important. And you want to kiss it. Keep it super simple. Start with what you're already good at. So if you're a writer, write about it. If you're a patient, use it, share your story. It sparks curiosity. Like, I brought the VR headset to my grandfather who's in the hospital recently, and the nurse saw it and she was like, "Oh, you're doing that." So that really sparked curiosity in her, and I wonder if she might go home and Google VR in the hospital. What are the benefits? Like I said here on the slide, if you're a writer, stories of uses. If you're a doc, maybe provide some information in your clinic about VR if possible. And then test what works in your facility, or test what might work for you or your patient, as far as what your needs are, as far as like the display. I think this is just some additional information. So where can we share this information? So you could share it in your clinic if you're a doctor. You could provide it to palliative care patients. We could even share it with other healthcare staff. And then really question, is this something that would work for me? Would it work for my patients? And then finally, in order to really adopt virtual reality for the healthcare patient, or for patients in healthcare, we really need to take that leap of faith that, yes, this might actually work. Many of us are under the assumption that whatever we did before that's working doesn't need to change because we're doing it now because we did it yesterday. But we really need to take leaps into trying new things and new ideas. So the mission is not impossible. How can you be an advocate too? Well, if you're convinced that virtual reality helps patients, please advocate for accessibility. Identify what you're good at, and then use that to your advantage to help promote virtual reality and for the use of in health. Use your voice to be the voice for virtual reality, like I'm doing right now. That's very easy. Share your experience of this modality so that many more patients can enjoy the benefits of VR. And your voice does matter, because each one of us can tell 5 people who can tell 5 people. So that is the completion of my presentation, and congratulations, you have just passed, and now you are the voice for virtual reality for healthcare as well. I've passed the voice on to you.
Thank you. And we have a set of good questions coming in. I wanted to kick off, hopefully you can hear me, with the question, the Netflix experience, from your personal experience, and you kind of got interrupted out of the cabin experience when they came into your room. Is that something like with training, and if you envision the future where health professionals would be aware of VR therapy, do you have ideas of how that could be communicated when they do need to come in and check on a patient and they're using VR, or like best practices, or just ideas of how that could work better so you don't get interrupted out of an experience?
Right, that's a great question. So the first thing that popped into my mind when you asked, when we're teaching Lamaze and we're doing a visualization exercise, we bring them back slowly to the present moment. It's not like an all of a sudden, okay, we're done, because that's very jarring and it's not a very comfortable or relaxing experience to go from like one frame of mind to the next. Like, so I think to focus on bringing the person back slow. Let's say maybe the patient is doing a VR experience. There could be something on the page door, like if the door is closed, you could say VR session in X time to X time, from like 1 to 1:15, for example. And then 1:15, we know can go into the room that the patient will be their VR experience, and we're not going to startle them or disrupt their VR experience. In the case where the cleaning lady came in, sat with her or anything, she really didn't have any idea what I was doing. And she was really cheerful all the time herself, and she was kind of like an experience to have. But if we knew that the patient was going to be our program and we wanted them to have the best experience possible, or specifically they're doing something to help with, and we are all on board with that, then to do it for a specific amount of time that everybody is aware of, and you know, we can go reassess the pain in 30 minutes after they have already completed their virtual. So as long as people know that the patient is doing this, I think that's probably the most important aspect of it. And I guess it's the difference between knowing that someone is doing this and not knowing. So if someone just comes into the hospital and they bring their own Oculus or their own whatever headset with them, and they just whip it out and start, you know, going into virtual reality whenever they feel like it, the nurse is not going to, or the doctor is not necessarily going to know that they're doing that, because they're not really a part of that process. Now, if they are in a different experience where the providers are aware, or that this is something that the hospital is offering, let's say somebody goes, like, let's say it's in palliative care, the patient goes into a room specifically for a VR experience and someone's facilitating that, then they can be on the same page and they can know when the patient is going into the VR experience, and they can see that like on the shared screen. They know when the patient's coming out of the experience mentally. So being on the same page with the patient, knowing that they're doing VR, is important.
That sounds. I'm going to put a comment here that there was just a comment, which you may have a reaction to. Allison Scheiberger said, "I met a physical therapist that utilizes VR for stroke patients regaining mobility." To just comment, but curious if you have experience with stroke patients and mobility.
I don't have any personal experience with stroke patients who are trying to regain mobility. I know that there are companies out there who specifically work with neuro rehabilitation and VR, but I personally have not had that experience. But I do think that VR is probably great for that. It's engaging the brain, it's engaging the senses, and that's really what got me interested in virtual reality, was the senses. Because even when I was learning about, I used to be an infant massage instructor, and we were learning about the touch, the sensation of touch, and how important that is as feedback for the. And so I think if you're using a tool to engage the neurologic system specifically, and that's the pathology for stroke patients in the brain, then I think that makes sense. So I think that's very.
Let's go to a question. Just how would you recommend getting your healthcare facility involved in VR for healthcare? Just a place to get started.
That's a great question, and I had to ask that question to my own healthcare facility. So if there's anyone from Ross, hello, and I'm going to give a personal first-hand example, real-world example. So, like I said, I was using the headset while waiting for one of my doctors in the clinic room one time. And the doctor said, "How can I get this for my patient?" And up to a couple of weeks ago, I really didn't have a good answer for her. But I had conversation with one of the doctors who had no hand in my care. I just knew that he had used virtual reality for robotic surgery training for his surgeons, I believe the residents who were under. I set up a meeting with him, and he gave me the advice to talk to my oncologist specifically about a grant called Quality of Life Grant, and that there would be possible funding for the headset, the hardware, and the software, meaning the headset and the apps, for the patients in that specific unit. So, like I said, one of the barriers would be cost, because the headsets are not cheap, and you may have to pay additional funds for the applications that you want to use, and those applications might need to be specific to your patient population. So I would start with trying to find people who are interested, number one, because if you find the people who are interested in your healthcare facility, they are going to overcome the other. And you start talking to people who think may have the answers, and you're going to find help, and they're going to help you, answer more of the questions that are going to come your way when you're trying to get VR into your healthcare system. I would do some research and find out, like I said, what's the patient population, what's the problem that you're solving for your patients as well. So if you have a patient population, let's say oncology, for example, because I'm very familiar with that as a patient, one of the main things that we deal with is this thing called scan anxiety, where you have a scan coming up and there's this anticipation that is almost like you cannot suppress this, because you feel you have this scan coming up and you're going to either get great news, you can move on with your life, or the opposite, and your life is going to change in a day all over again. And so, you would have, what kind of app would someone with scan anxiety? So we need to help them relax, we need to help them focus. And then what kinds of apps or companies provide relaxation or meditation? Excuse me, do we want something that is clinically based? Do we want something that anybody can get from the app store? What your needs are. So say researching the headset or app is probably pretty important based on what your patient's needs are. What's the problem you're trying to?
I want to say thank you so much, but we really appreciate your presentation today. You brought us a whole new perspective on thinking about accessibility and really thinking about the experience that any of us can face going into the hospital and in the healthcare system, and how VR can use to help us. So we really appreciate the presentation today. Thank you, everyone, and have a great day or night wherever you are.